And it looks like we are live. Hello, everyone. Thank you for joining us for another Ask an Expert with TGH, one of our live Q&A series with so many of the world-class experts that we have at Tampa General Hospital. And we're very excited about today's conversation. It revolves around some of the really important work that's happening treating COVID-19 patients here at Tampa General Hospital and some of the groundbreaking treatments that we are seeing some real success with some of these patients. So again, I want to welcome everyone into this conversation today. This is a live Q&A, so we want to encourage you to submit your questions for our panel of experts in the comment section below. Today, we're really going to be talking with these experts about how monoclonal antibody therapy is being used here at Tampa General Hospital to treat COVID-19 patients. Let's first introduce you to our panel of experts. I'm really excited to have this conversation with all three of you here today, starting with Dr. Seetha Lakshmi. She is medical director of our Global Emerging Diseases Institute, also associate hospital epidemiologist here at Tampa General Hospital, and assistant professor within the Division of Infectious Diseases and International Medicine at USF Health Morsani College of Medicine. Dr. Lakshmi, thanks very much for your time. Dr. Peggy Duggan is Executive Vice President and Chief Medical Officer here at Tampa General Hospital, in which her role oversees the functions related to the physicians and patient care here at our 1,007-bed facility. Dr. Duggan, thanks very much for your time this afternoon.
Thanks, Phil.
And we also have Kristen Zeitler, Pharmacotherapy Specialist in Infectious Diseases and a member of the Antimicrobial Stewardship Team here at Tampa General Hospital. Her responsibilities include promoting the optimal use of antimicrobial agents and reducing drug resistance. Dr. Zeitler, thank you very much for your time.
Thanks, Phil.
So again, I want to remind anybody out there watching, if you have questions during this live Facebook session, just put them in the comment section down below. We will do our best to get to those. Try to keep them general in nature if you can, not too specific to your own situation, because we want to make these questions relevant for whoever's watching. And then I do want to remind you, we may be talking with our medical experts here in this series, but you should always consult your primary care provider for individualized medical advice. These are great general conversations to get really important and good information, but when it comes to you and your own personalized care, you want to make sure to consult with your primary care provider. So with that, let's get into this conversation, because it is really exciting stuff that we're going to be talking here today. And it is about some of this incredible work treating COVID-19 patients here at Tampa General Hospital's newly opened Global Emerging Diseases Institute. So I want to start, Dr. Duggan, do you mind sharing with us just a little bit about the Institute and what it means both for medicine and for our residents and our patients right here in the Tampa Bay area?
Of course. Thanks, Phil, for that opportunity. So the Global Emerging Diseases Institute is really an opportunity for us to coalesce around these challenging medical problems. So COVID-19 may be the motivator, but the care of patients with emerging diseases is a complex problem. What Tampa General has done, which is unique, is to take all of our experts, both pre-hospital, in the hospital, and post-hospital care, and really circle them around the patient and what's the right care of these patients. In addition, we've been learning from that work, working as a team, creating the right processes and treatments for when to provide the monoclonal antibodies we're here to talk about today, but also other types of therapy and home care that have been really critical to keeping Tampa Bay safe. And that work has been really well received in our community, but more than anything, it's made us a leader in the outcomes in COVID-19. And we are in the top 20 in the country for outcomes for COVID-19 for the hard work of our staff, nursing, physicians, researchers, coming around this problem together. And we're learning from that and want to keep that going for other issues that come to this community.
That's fantastic. Dr. Lakshmi, do you have anything you want to add there, just in terms of your being the medical director at the Global Emerging Diseases Institute?
Well, no, Dr. Duggan covered it very well. So I want to add, thank you for the community for being partners in this. And we have grown and we have learned, and now we stand, like she mentioned, top 20 in the country, and that wouldn't be possible without the engagement of the community as well as our leadership and the team members. So big thank you for that.
Well, thank you for the hard work of you and your team, Dr. Lakshmi. Let's get right into this monoclonal antibody treatment, because it is fascinating what you and your colleagues have been able to do with this treatment. But, monoclonal antibodies is a big word. I didn't know what it meant when I first heard about it. So can you please tell me, what is it and how does it work?
Sure. Kristen is a resident expert. I'm going to hand over the question to her, and I'm happy to fill in. Kristen?
Certainly. Thank you, Phil, and thank you, Dr. Lakshmi. Happy to be here with everyone, including Dr. Duggan. So, Phil, as you mentioned, monoclonal antibody is a big name, is a big term. What that is it's a cocktail of medications. There's 2 available monoclonal antibody cocktails. I won't get into the drug names because that's even more confusing as to how to pronounce them. But the intent of the medications is to bind to a part of the virus that causes COVID-19, which we in the medical community refer to as the spike protein. When these drugs bind to the spike protein, it's meant to neutralize or inactivate the virus so that it cannot cause further illness and further harm to our patients. So the overall intent is for these medications to be given to those patients that are in the outpatient setting, not in the hospital, to prevent them from progressing to severe COVID-19, which we see in the hospital as those patients requiring oxygen and having this severe illness.
So like Kristen mentioned, if you conceptualize it like a war zone, this is essentially like throwing bullets at the virus. So the monoclonal antibodies just go attach to the virus where it tries to bind to the human, and it prevents it from happening. I will quickly share a graphic here that can show further where it acts in the nature, and it's really important to understand that portion of it because it helps us to give it in the right time. So let me program this. Click here into a slideshow. So as you can see in this picture, we try to target the monoclonal antibody early in the viral replication phase. That's where the virus is dividing into multiple copies. The monoclonal antibodies work really well within the first 7 to 10 days. So at this time, as you can see, the monoclonal antibody at the Tampa General Hospital, we've given it to more than 700 patients, and it has decreased hospitalization in 77% of these patients. The key is to early get into the program or treatment early, and this program at Tampa General has been recognized by the Warp Speed as one of the best in the nation.
Impressive, very impressive. And you make an excellent point there, Dr. Lakshmi, in that it is critical. I think one of the big things we're learning about monoclonal antibody therapy is how critical it is to get patients in that early window, correct? That first 7 to 10 days.
Correct. That is the key thing. If there's one thing we can remember from this discussion today is that if you know anybody who has COVID, refer them early to come in to get the treatment. That's where the most benefit is. We can prevent the virus from multiplying fast.
Good point there. I do want to remind anybody who's watching, please submit your questions for our experts in the comment section. We're watching that, and we do want to take your questions because this is a great way to have this conversation. And sometimes some of the best questions come from you out there watching on your own computer. So please keep those coming. We're getting another one here. We're also getting some love for TGH here as well. So just so our panelists know, there's some big thank you TGHs in the comment section as well. That's always nice to see. Can one of you tell me, I don't know if this would be Dr. Zeitler or Dr. Lakshmi or Dr. Duggan really, who is eligible to receive this treatment, and is there a cost associated with the therapy?
And Phil, I'm happy to take that question to start off with the other panelists adding into my comments. So when these drugs were first made available, the intent from the FDA under the emergency use authorization was to target patients that were at high risk. from progressing to severe COVID-19 disease. And we had a few examples of those patients that were of older age, patients with certain medical conditions, or that were immunocompromised. However, if there's anything we've learned over the course of this pandemic over the last year, is that we continue to learn things about this virus and how it affects patients. One of the biggest things that actually was acknowledged by the FDA as of last Friday is that there's many more patients than those we initially felt were at risk for progressing to severe COVID-19. So as of last Friday, the FDA widened that patient population and those types of patients that can receive this monoclonal antibody therapy. As Dr. Lakshmi said, we've seen huge successes here at Tampa General, and we want all of those patients out there that can derive benefit from these therapies to be referred by their providers and to get these medications. So while there's certain examples of patients that the FDA suggests definitely should get these therapies, they also acknowledge that medical providers also have a role in identifying those individuals that they're caring for that they feel are at risk. So at this point, if you are infected with COVID-19 and you have mild symptoms, seek out care from your medical provider, and anyone that is in the community likely is eligible for these therapies that can be referred to centers such as ours at Tampa General.
Thank you, Dr. Zeitler. And in terms of the cost, maybe an out-of-pocket cost, if they're worried about, how this can set you back, fill me in on that, on the particulars there. What do people need to know?
So I can take that one, Phil. So I think most important to everyone is that the hospitals, the drug makers, and the government have really come together around this disease to want to make care accessible. So the first thing I would say to anyone is if you're worried about cost, the first thing I would say is first you need care. And so come to us and to receive your care, because this is important to the community. From a cost perspective, we really have been able to, unlike in other diseases, work very hard to keep these costs low, especially in these ambulatory situations where people are coming in for a treatment to prevent a hospitalization. So my advice, and I think it's really important to think about, this is something we want to provide to you. We will work with anybody, but as it turns out, this has really been great work between hospitals, government, drug makers to minimize the expense to patients on all fronts. And so please do come forward and don't let that be the barrier. We'll always be able to work with people to get their care taken care of.
Another reason I'm going to work at Tampa General Hospital. We're getting some good questions. Let me give you this one that just came in from Dennis, which I believe I know the answer to this, but I want to let the experts answer it. Dennis wants to make sure that this is only used for sick patients. This is not a preventative therapy. Is that correct?
So actually, that's a very, very important question. The most important question why we're here today. This will actually prevent you from getting sick. So you don't need to be already sick with the virus. So if you are diagnosed with COVID-19, don't wait. It will prevent you from getting sicker, needing to be admitted to the hospital, or God forbid, being on the breathing machine. And it's a 77% success rate, which is an amazing, amazing thing. From where we started to have nothing to treat with to where we have. So this is a really preventive. So the top thing is vaccine to prevent. But, if you get the disease and this is the way to prevent it from getting any further.
Dennis has a follow-up question as well that I'm going to throw at you guys. He's asking if all hospitals have monoclonal antibodies.
So certainly all hospitals have access because it is an FDA approved under emergency use authorization, and then further. So all hospitals have access. Whether or not they've set up clinics, made it accessible, or have an easy way for people to be cared for and diagnosed is a different question, but certainly it's not limited to any hospital. I will say I think Tampa General has taken this on in a really significant way for the community so that it's easy to get care here and that we are working to keep the community healthy and safe.
Excellent. Dennis, thanks for being part of the conversation and thank you for your questions. We also got a great question submitted in advance before this by Subash, and I want to pose that to our panel of experts now. Subash is asking around the topic of transplant patients and their level of after being fully vaccinated. Are there instances where even after receiving the vaccine, a transplant patient still might not have the antibodies that are needed against COVID-19?
So that's a great question. And I want to point out, today we are in a much better place than when we started out a year more ago when COVID first came out. We have the vaccine. Unfortunately, there are certain groups of patients that don't fully respond to vaccine. Now, what do we mean by that? A vast majority of people who get the vaccine, you heard the rates, 90%, 95% effective. They're not 100%, but very high percent effective. And even when they're not 100%, they will prevent you from getting really, really sick and being admitted to the hospital or, God forbid, losing your life. So even when they don't work 100% of the time, they decrease the severity of illness. I personally would much rather have just a head cold than having to be in the hospital with a breathing machine. So that's a huge advantage. Now let's talk about the vulnerable population, the transplant patients, the patients who are getting chemotherapy, who have weakened immune systems. Yes, their response rates are, from the studies that we have seen, are not as great, but still it's around 54%. But when we say not as great, they can still prevent you from getting deathly ill. You might still catch disease. Now, transplant patients in particular tend to be on the very, very high risk category, Phil. So for all those community members that are in touch with our transplant family members or colleagues, this is what the mask wearing is about. You're protecting the most vulnerable, right? And for our transplant patients, we continue to recommend until we know further that they wear a mask, do the mitigation, the distancing, and take the precautions, because we're still learning how to best boost the immune system for transplant patients. Other panelists, if you have any thoughts or comments around that.
Yeah, and one thing that I would add to Dr. Lakshmi's comments, certainly I know people are concerned about if they get COVID-19 after they have been vaccinated. And while certainly that could be a possibility even with mild illness, that does not preclude the receipt of previous vaccination, does not preclude patients, any type of patients, but from being able to receive monoclonal antibody therapy if they are diagnosed with COVID-19. So I just want people to keep that in mind, that they still will be eligible for these therapies and they still can be very successful in those patients who have been diagnosed with COVID, even in the setting of being vaccinated.
So, and if I may, I'll add one more comment about the transplant patient and vaccination. And this is one of the things we've been talking a lot about here at the hospital as we have our own efforts around vaccination. One way transplant patients and patients on chemotherapy and other patients who are immunosuppressed can be protected by the vaccination is by the rest of us being vaccinated. So that is really what herd immunity, that term we hear now all the time, means is if we have enough vaccinated people in the community, we'll stop the spread of the disease and we'll protect our colleagues, friends, and family. And so it's just something to think about as you're weighing your own decisions around vaccination. I know this is a hard decision and a thoughtful decision for a lot of members of the community, but it's really important for each other to consider that.
Excellent point, and really great teamwork on that answer. I think all three of you brought some really important information to that answer. So thank you very much for taking the time to answer that so thoroughly. We're running a little long. We got one more question in the chat that I'm going to pose to you guys before I let you go. So Hope is asking, have you treated any immunosuppressed patients with monoclonal antibodies?
Yes, that's a fantastic question. In fact, majority of our patients in the study that I showed you, where we treated more than 700 patients, and 77% of them had decreased chance of hospitalization. Majority of them were transplant patients. So really a big shout out to the team that has the transplant team that has referred patients early, has awareness around it. This is one of the best tools we have in our toolkit to protect, beyond the vaccination, to protect our transplant patients, is using monoclonal antibody. Kristen, you're part of the study. You were involved in that study very heavily. So please, if you have any thoughts around that.
Yeah, certainly would echo everything that Dr. Lakshmi said, and it's just really exciting the success we've been able to experience here at Tampa General with those vulnerable populations, the transplant patients that Dr. Lakshmi has mentioned, and we feel very passionate about this therapy, so certainly want people to consider it as an option for them should they be infected with the virus, whether they're immunocompromised or not. We've had a lot of success and certainly have plenty of available drug for those individuals in our community.
Excellent information and good questions from our viewers out in the internet or wherever you're watching from. So thank you for those great questions. And I'm going to let everybody go because our three experts are extremely busy. I do want to say thank you to all three of you, Drs. Lakshmi, Duggan, and Zeitler, for your time, your expertise, your perspective on this, and also for all of your hard work on the front lines of this pandemic. And we have a couple reminders here for our audience. If you want to learn more about monoclonal antibody treatment at Tampa General Hospital, you can go ahead and visit www.tgh.org/monoclonal. And we've got all sorts of really good pertinent information, everything from patient eligibility to where you go, where you signed up, everything you need to know all in one place right there at that website. Without anything else, I'm going to let our panel of experts go. But again, thank you everyone for taking time to participate in this conversation. And any last words from any of our three panelists?
Well, I think it's great everyone has been tuned in and grateful to have the opportunity to talk to our community. It's really great.
Yes.
Excellent. Thank you all three so much for your time. Thank you for joining us for another Ask an Expert. This is part of our live Q&A series with some of our world-class experts here at Tampa General Hospital. This has been another fantastic conversation. I've certainly enjoyed it. You all three have a great rest of your day. Thanks, everyone.
Thank you.